Getting shot in the eye sounds like something out of a horror movie, but it's actually becoming fairly common among seniors being treated for vision disorders with the drug Eylea. So common, shares of Regeneron, the company that makes the drug, have soared more than 600% over the last 3 years, and your Medicare dollars are behind the surge.
Cornea clear.
Eylea can slow vision loss from age-related macular degeneration.
Distortion when reading text, or the inability to recognize a face, loss of ability to drive a car, things that involve central vision. 90% of patients would gradually continue to lose vision, even with the best treatment that we had. With the introduction of drugs like Eylea, it's completely turned around.
Dr. Jason Slachter was a consultant in the clinical trials of Eylea and was the first doctor to administer the drug commercially. He now says he does 20 to 25 injections a day.
Get all the bubbles out. I've been in practice for 26 years. The first 15 years was spent telling most of my patients, I'm sorry, there's nothing I can do. It hurts when you can't help somebody. And with the introduction of these drugs, my world changed. Anti-VEGF drugs, and Eylea now in particular, really has the capability to take someone's life with this devastating disease and turn it around.
I'm a lucky patient.
Rest your head back gently. Right eye, correct?
Correct.
The best thing that ever happened to me was the Eylea.
Comfortable?
It was getting worse and worse. The distortion stops. I can do everything I would normally do. What more could I ask?
Len Schleifer co-founded Regeneron over 25 years ago, and the road to profitability wasn't always so clear.
Didn't know where its lifeblood of money to operate was coming from, and we thought we might run out at any given time. And there were plenty of times like that over the years. But we had this belief that the world needs innovative products.
Once the FDA approved the use of Eylea in 2011, the company knew it had a hit. In just the second quarter of 2014, Regeneron sold over $400 million of the drug.
Here we go.
It's not cheap, though. Each injection, given once every 2 months, costs almost $2,000, and Medicare covers 80% for patients over 65. In 2012, the most recent data available, Medicare spent $294 million reimbursing ophthalmologists for administering Eylea. And since then, Regeneron sales of Eylea have more than doubled. Competing drugs, one of which is significantly cheaper but complicated by manufacturing and regulatory hurdles, need to be given twice as often. And when treatment means a shot in the eyeball, people care about frequency. But does it actually hurt?
The reality is the injection is fairly benign.
Really didn't feel anything. You can actually see where he went in.
It's about 3 seconds, slight discomfort, and I know anyone watching this is going to say he's crazy. It really isn't that bad.
Especially if you're a shareholder. Matt Egan, CNN Money, New York.